Welcome to the webinar, everyone. We are going to start in a few minutes. Let us give our colleagues time to join in. Thank you. Welcome, everyone. We are about to start our webinar in the next few minutes. Let us give our colleagues time to join in. Thank you. Hi, everyone. I believe we are now ready to start our webinar. Good afternoon, good morning, and a very warm welcome to everyone joining us today. Thank you so much for taking the time to be here for the launch of the annual donors delivering for SRHR report. As we do every year, we are here to ask one central and vital question, and that is going to be, are donors delivering? So over the next 1.5 hours, we will walk through the 2026 SRHR financing check together and unpack what the data tells us about global commitments and the gaps that are there. I am going to be your beautiful moderator for this session, and my name is Melissa Anaseli. I am a project nurse at Youth for a Sustainable World, formerly known as DSW Kenya, a non-profit organization that empowers young people, especially girls and young women, to lead healthy, sustainable lives. We work directly with communities, higher learning institutions, and young people to promote access to vital SRHR information, do HIV prevention, gender equality initiatives, and increase access to information and services of modern contraceptives. Our work is usually grounded in youth empowerment and just creating safe spaces where young people can make informed decisions about their health, their bodies, and their future. So, how a quick housekeeping note. The webinar is scheduled for 90 minutes. However, our panel might be running a tight ship. We will try to wrap up our discussion about 15 minutes ahead of time to give you some time back in your day. We are good people, I know, yeah. So with us, we have representatives from DSW, the Swedish government, the European Commission, the Guttmacher Institute, and yourselves, our important people, to look closely at where we stand when it comes to donor support, funding priorities, and real people on the ground. So, as many of us know, several traditional champions of SRHR and development financing have recently announced severe ODA cuts, and this decision places decades of progress at risk. Funding trends are not just abstract numbers on spreadsheets for us. They determine whether clinics are going to experience contraceptive stockouts, whether young people and our youth centers can have access to rapid HIV test kits, and whether essential services remain available on our clinics and other youth centers. Because we all know when funding is unpredictable or declines, young people, particularly young girls or adolescent girls, they face heightened risk of getting unintended pregnancies, unsafe abortion, increasing the risk of sexually transmitted infection. So, in this context, SRHR becomes not a guaranteed human right, but a matter of geography and politics. So, before we jump into the data presentation, we will open with a short video, a global framing video, which is a recorded statement from Mr. Samuel, Director of External Relations at United Nations Population Fund. Welcome again.
Good afternoon. On behalf of the United Nations Population Fund, I would like to congratulate DSW on the publication of its Donors Delivering for SRHR report and thank them for convening this important discussion on financing for sexual and reproductive health and rights. At a time of growing pressure on development cooperation budgets, it is more important than ever that we track commitments, monitor trends, and strengthen accountability, because what is not counted does not count. Official development assistance remains essential for advancing SRHR where domestic resources alone fall short. Worryingly, in conflict situations or natural catastrophes, SRHR services are often the first to disappear. Tracking tools, like the Donors Delivering for SRHR report, help us understand where resources are going and where gaps remain. This not only increases transparency, it also encourages sustained investment. Accountability is not only about numbers, it is about ensuring that commitments translate into real services, real choices, and real rights for people everywhere. I thank DSW for their leadership and their commitment to advancing rights and choices for all. Thank you, and I wish you all a very successful discussion.
Thank you. Thank you for that powerful message, Mr. Sam. He's warning about how global fragmentation directly undermines healthcare delivery hits home for us. As a healthcare provider in Kenya, we usually say work documented was work not done. You cannot really account for it if you didn't document it. So it sets sobriety reality for why tracking this money matters. So as we are leading on with the meeting, let us remember what is not counted doesn't count. I will now invite Nitya George, Policy and Advocacy Officer, together with Lisa, Head of European Union Advocacy, the lead authors of the Donors Delivering Report from DSW, to present the key findings of the analysis this year. And joining them is Dr. Elizabeth Sally, Director of International Research at the Guttmacher Institute and a valued member of the Reports Advisory Committee. Over to you, Nitya, Lisa, and Elizabeth.
Thank you so much, Melissa, for that wonderful introduction and for kicking us off on the right note. If we could please have the slides, we can get started on the SRHR financing check. Hi, everyone. It's wonderful to have you joining us today for the launch of the Donors Delivering for SRHR 2026 report. And as Melissa mentioned, this year we need to ask, are donors delivering? And maybe we can do a little bit of an reality check together. Could we have the next slide, please? So for those of you who have joined us to discuss previous editions of this report, you may already be familiar with the principle behind it and why we do this analysis each year. But just to reintroduce you to that, DSW is a firm believer in advocacy recommendations that are substantiated by reliable data. So policymakers and civil society alike require concrete evidence to guide decision making and resource allocation, to understand how ODA funds are being used, find ways in which to hold donors and implementers accountable, and of course, to provide insights on critical gaps in funding. And given the current funding climate that we're all familiar with, this to us seems more important than ever before. Before we get into the findings, we just wanted to share here on the slide a couple of bits of encouraging feedback that we've received from decision makers. So we're really happy that the data is sort of reaching the right decision-making spaces. Could I have the next slide, please? So what do we track? Sorry, could we go back to the slide just before this? Thank you. Just to give you a quick idea of the methodology, as you may already know, this report looks at how members of the OECD DAC, so that's the OECD's Development Assistance Committee, provides disbursements to the full breadth of SRHR. We follow the SRHR definition put forward by the Guttmacher-Lancet Commission. In addition, we also report on the overlapping fields of FP, so that's family planning and RMNCH, reproductive, maternal, newborn, and child health, that are, of course, overlapping with SRHR. And a big part of this analysis is to understand what share of each donor's ODA is going to each of these fields. Next slide, please. Thank you. So a bit of an overview. The 2026 report presents the latest confirmed data from the OECD DAC Creditor Reporting System, so the CRS, from 2024. That's the latest available data. And it covers 33 OECD DAC donors, the latest addition to this list being Latvia in 2024. The methodology and numbers for each field that we report on are available in the annexes of the report, so please do feel free to take a closer look and come back to us with any questions or comments. We calculate each donor's bilateral and multilateral funding and then apply imputed percentages for specific CRS or purpose codes. We pull out data from the OECD database in net disbursements and at 2023 constant prices for this year. So all the analysis that you'll see is available in this format. As mentioned in this slide, we also try to incorporate, where relevant, preliminary ODA numbers that were made available, for 2025, and these were made available by the OECD in April of this year. A final disclaimer before we finally get into the data is when we compare year-to-year differences in disbursements, often changes can be due to logistical or administrative reasons, so could be the spacing or timings of disbursements, rather than strictly being year-to-year reflection of political will. With all of that background in place, maybe we can get into the findings. Could I have the next slide, please? Okay. So what are the overall funding trends in 2024? In 2024, we see that the SRHR funding increased to 15 billion USD. This is an increase of 3.4 billion USD or 29% compared to 2023. While this may seem like good news at first glance, there is a little bit more to unpack here. Across the 33 donors that we looked at, we find that the percentage of the total ODA going to SRHR also rose. So that's the line graph that you see in the middle of the screen. It rose from 4.4% in 2023 to 6.2% in 2024. Like I said, it might look like good news, but a bit more to look into this is that we see that a big part of the increase in 2024 is due to the timing of big US disbursements. You may recall that in 23, we had reported we had seen a big drop in SRHR funding, also linked with US disbursements. And compared to that drop, this looks initially like a recovery. However, in reality, outside of the US's disbursements, we see that contributions from other donors have fallen substantially in 2024, including from some of our historical champion SRHR donors. Additionally, just a bit of context in the rectangles that you see at the bottom of this slide, we see that the total ODA fell in 2024, while total SRHR disbursements increased, which also causes the percentage to go up. This is just to give you an idea of the year-to-year interactions between ODA and SRHR disbursements and how that also leads to increases or decreases in share of ODA being spent on SRHR. Thank you. Could I have the next slide? So how do donors rank when we're looking at SRHR disbursement? So that's the absolute amount that's being disbursed from donors. As you can see in the graph on the left, the US provided over 10 billion of the 15 billion USD total SRHR disbursements in 2024. This is followed by Germany, Canada, the UK, and France at around the $500 million mark. So that's quite a big difference. And of these, Germany, the UK, and France all reduced their SRHR disbursements between 23 and 24. So this shows that despite the strong influx of funding from the US in 2024, a future downward trend in terms of funding amounts is already emerging. And this is in keeping with what we know in terms of policy announcements and SRHRD funding from two big donors such as the US and the UK. But it's also in line with the overall decreasing ODA levels that we were expecting to see 2024 onwards. The diagram on the right shows us that between 2023 and 2024, 2/3 of donors decreased their absolute SRHR spending. So outside of the large disbursement from the US, many other donors decreased ODA and along with that, their SRHR contributions. So again, reducing ODA doesn't necessarily have to reflect a deprioritization of SRHR, but it could certainly reflect a broader deprioritization of ODA on the whole. So this is looking at absolute spending amounts. And when we do that, we always need to keep in mind that bigger economies naturally will tend to have bigger ODA budgets and therefore larger SRHR disbursements. But this doesn't automatically reflect a prioritization of SRHR, which is why it's important to analyze the share of ODA going to SRHR, which is what we will look at on the next slide, please. Okay, so this is important because when we look at the share of ODA that was invested in SRHR, we can make more accurate assumptions about the importance of this area of work to each donor. So we see that in 2024, there are 6 donors who gave over 5% of their ODA to SRHR. The US, of course, is at the top at 16.7%, followed by Iceland and Canada over 6%, and the Netherlands, Luxembourg, and Sweden at over 5%. You can see that the order and ranking are quite different when comparing absolute disbursements versus relative spending on SRHR, and we see some smaller and medium-sized economies sort of shining through and giving more importance to SRHR, for example, Iceland and Luxembourg. We're also very happy to have here with us Dr. Karin Wiesel from the Swedish government, because we're hoping that she'll be able to share a bit of her perspective as a member of a long-term SRHR champion donor country and government. And we hope that she can tell us a little bit more about Sweden's future outlook and commitment towards SRHR. Coming back to the findings, another important bit of data that we have is that 14 out of 33 donors in total spent less than 2% of their ODA on SRHR, including development cooperation giants, champions like Germany and the EU institutions. We also found that roughly half of the donors' relative SRHR spending, so that's the SRHR ODA percentage, decreased between 23 and 24 and roughly increased. So many of these increases and decreases can be linked with natural fluctuations year to year, which also includes the relatively extreme fluctuation we see with the US. But in a couple of cases, for example, the UK, we do know that some of that decrease is linked with significant funding cuts to SRHR programs 2024 and onwards. With that, I think I will hand things over to Lisa, who can offer us a bit more perspective on this data and also a little bit of a future outlook on SRHR financing. Over to you, Lisa.
Thank you, Nitya, and thank you, Melissa, for guiding us through this year's launch event. If I could have the next slide, please. Let's see what kind of stories the data tells us this year. The first story is unfortunately one of systemic fragility because of the high dependency on very few donors, as Nitya already kind of alluded to. So while collectively the 33 donors invested little over 6% of the collective joint global ODA, total ODA, towards SRHR. If we take the US out of the equation, the remaining 32 OCDAC donors only spent around 2.4% of their collective ODA on SRHR. Meaning without the US contribution, there would have been less than $4.4 billion US in SRHR funding in 2024. And on the next slide, we zoom into these $15 billion US in total SRHR funding. So it's a little bit the same story, right? Well, it's the second story I would like to tell you, and that Nitya has already also kind of mentioned, which highlights the same issue, right? 70% of the total 15 billion US dollars in SRHR funding came from the US in 2024. 4% of the total came from Germany and almost 3.5% from Canada. And the UK, as you can see on the graph, is also close to that. So if we take out these top 3 donors, the remaining 30 donors jointly contribute only 22% of SRHR disbursements in 2024. So this means that almost 80% of the globally available SRHR funding depends on political decisions taken in Washington, Ottawa, and Berlin. So this high donor dependency is, of course, highly problematic. SRHR funding has huge positive impact, as we will see and hear more about from Beth later on. So if 3 governments have the power over that impact, or worse, the lack of impact, that can be felt really across the globe and across recipient geographies. And this explains the fragility of the system and the disruption of services and commodities that we saw following the US defunding of ODA and in particular SRHR in the last years. The third story, the data tells us on the next slide, is a more positive story of kind of the unsung heroes who can punch above their weight. So Nitya already told us that there are some smaller economies with more limited ODA budgets, naturally, because of smaller economies. But those invest a bigger share of these budgets into SRHR, leading by example and prioritization despite the more limited budgets. So this is, for example, as you can see, we're plotting here total SRHR disbursements against SRHR disbursements as percentage of ODA. For example, Luxembourg or Iceland are kind of the unsung heroes of this data. And if we go to the next slide, it's the same graph, but combined with the detailed country profiles that the report also offers in the second half of the report, it tells us a fourth story, namely one of a potential commitment gap. Because some of the countries you see here, which have quite low percentages allocated to SRHR, low percentages of their ODA, do actually have quite strong and progressive and commendable policy commitments to SRHR. So one example is the European Union, and I think we will hear about it more from Cecile Biot later on. There are a lot of commitments in legislative basis of external action instruments and policies and strategies. And sometimes, it's not a matter of lack of political commitment, but a gap between the political commitment and the funding that we see. Next slide, please. So unsurprisingly, as Brussels-based advocates, we did want to zoom into the EU and tell another story, namely one of maybe a champion in waiting, let's say. So while the EU is the second largest ODA donor in general after the US, and the 9th largest SRHR donor in terms of absolute disbursements, it ranks only 24th when you're looking at percentage of ODA allocated to SRHR. So again, I'm glad that we will hear more about the EU's activities in the area of SRHR as part of their external action, because there are very positive examples that, of course, we as advocates would like to see more of. For example, the Team Europe initiative on SRHR in Sub-Saharan Africa, which is also an example of the EU's convening power. So not just a large ODA donor and financial power, but also the power to convene. Next slide, please. Finally, the last story I would like to tell is quite an alarming one again, or a shocking one, even though from our 2026 perspective here today, not a surprising one anymore, is one of the calm before the storm. Nitya mentioned before that at the beginning that despite the rising overall funding levels in 2024, which is when we have the last confirmed data from the OECD DAC database, we already see 2/3 of the donors decreasing SRHR funding, often linked to decreasing ODA levels in general. But the preliminary data that is available for 2025 shows a historic decline in ODA by over 23% in 2025. And it's bringing the ODA levels in 2025 back to where they were at the start of the 2030 Agenda for Sustainable Development, which was around $174 billion. So 3/4 of this decline were driven by the US alone, as we can all imagine. But if we look beside that, a shocking number, we see that actually the majority of DAC members, so 25 out of 33, decreased their ODA in 2025, including the 7 largest SRHR donors. And to, to go even a bit further, the current projections point to a further decline of ODA in almost 6% in 2026. But knowing that the 7 largest ODA SRHR donors also decreased their ODA in 2025, we can already expect an impact on SRHR funding levels, of course, which makes the prioritization of SRHR and the percentage and looking at the share of ODA spent on SRHR even more important, and gives us a task as an SRHR community to show the positive ripple effects of SRHR, and that it's kind of the basis for a lot of other positive transitions that we can achieve with external cooperation, and hopefully see prioritization of SRHR when ODA levels are shrinking. Just on a methodological note, Nitya told me to mention that the 2025 data is based on grant equivalence, and the donors delivering numbers are based on net disbursements. So if you see small variations, this is probably how they can be explained. Next slide, please. Finally, just very quickly would like to show you what else you can find in the report. For example, this kind of overview ranking page. And on the next slide, you can see an example of what the donor profiles look like. Here on the next slide, you can see the donor profile of the EU. So you can find individual donor profiles for all the 33 donors that we're covering in the report, each including a description of their policy commitments as well, which is where you can identify a bit of this commitment gap sometimes. And the funding developments, both in terms of SRHR, FP, and RMNCH funding, plus a section where we are using the data from the amazing impact investment calculator tool from the Guttmacher Institute, which is the perfect bridge over to our next speaker. But I do believe we still have the QR code to the report on the next slide, which we can also share the link in the chat, so we don't need to perfect. Thank you so much. Our tech support is really on it. Yeah, very grateful for Beth to join us here today and for the annual collaboration, because it's thanks to the FP Impact Calculator tool that we can include the data and show what it actually means. The funding levels, important to distinguish, of course, that the donors delivering is focused on sexual and reproductive health and rights funding data, while we also have the FP data, and the impact investment calculator tool looks at FP funding, which is already probably a very complex endeavor to estimate. So warm welcome to Elizabeth Sully from the Guttmacher Institute, who is here to tell us more about these numbers and to share some additional insights about the expected funding cuts. Beth, over to you.
Thank you, Lisa, and thank you, Nitya, for walking us through the latest report. I open your report many times throughout every year, so I'm excited to have the latest one available to start using and looking through again. So just so much appreciation for the work that goes into this and the latest data. If you go to the next slide, I'm going to walk through, as Lisa mentioned, the impact estimates that are included in the donor profiles in the report, and to sort of not go through all of them, but zone in on a couple key ones and the stories that they tell. So the latest donors delivering report found that the 33 OECD DAC donors contributed about $1.96 billion to family planning funding in 2024. And this funding, using the family planning investment impact calculator, estimates that that funding enabled nearly an additional 170 million women and couples to access modern contraceptive care. And that in turn averted 50 million unintended pregnancies and saved over 45,000 lives in 2024. To sort of put that in context, it's estimated in 2024, there were 714 million women in low and middle income countries using modern contraception. So this funding from the 33 donors funded a quarter of all global modern contraceptive use in low and middle income countries in 2024. The 2024 numbers also represent an increase of $72 million compared to 2023. And with the calculator, we're able to reveal how even a modest difference in financing can lead to an additional win. So this additional 72 million that we saw in 2024 compared to 2023 meant that there were 6.3 million additional women and couples who could access contraception, that there were nearly 2 million more unintended pregnancies averted, and over 1,600 lives saved, compared to what we would have seen achieved if funding had remained at the levels from 2023. Next slide, please. So now we're going to look at some specific donor examples to better understand how much of an impact consistent versus fluctuating funding can have in the context of family planning. So we can see on the left that the EU institutions provided about $137 million to family planning in 2024. And that funding enabled nearly 12 million women and couples to be able to access modern contraceptive care. And it meant that over 3,000 lives were saved in 2024 alone. Similarly, on the right, the UK is estimated that there was $190 million to family planning in 2024. And that funding prevented approximately 5 million unintended pregnancies, which included 1.8 million unsafe abortions that were prevented. As mentioned before in this webinar, it's not really reasonable to think of year-to-year changes in funding being directly correlated to political will increasing or decreasing, but it is helpful to look at these numbers and see how even a modest increase of, say, $10 million like we saw from the EU institutions on the left, can bring additional wins. Or how when there's a drop, like in the UK's funding on the right, it can lead to missed opportunities for increasing contraceptive care. And so we see, looking at the slide on the right, that when there was this decrease in funding between 2023 to 2024 in the UK, there are almost 7 million fewer women and couples that were able to access modern contraceptive care as a result. One thing to note is that these impacts are really high-level impacts that allow us to compare across donors and across years And it uses the Guttmacher's Family Planning Investment Impact Calculator, and it estimates these impacts based on what we would see sort of as an average across all low and middle income countries. And I wanted to note that just because at Guttmacher, we also produce for some of these same donors a more detailed just the numbers report. And that really tracks where family planning funding was spent across specific countries, across different multilateral institutions. And this allows for more detailed estimates of impacts based on where money was being spent by each donor. And I just flagged this because it does mean that there are some differences in the estimated impacts for certain donor funding for 2024. Next slide. I want to just sort of end by talking about impacts focusing on the US. And while Guttmacher has more specific estimates of the impacts of US funding, the Donors Delivering Report provides a really good high-level snapshot of the impacts of the disbursements that were going out in 2024. So we can see in the report, the US dispersed nearly $1 billion in family planning in 2024. And this had the potential to increase modern contraceptive coverage for 85 million women and couples, to save over 20,000 lives. But it's worth noting that the disbursements from the US do vary a lot year to year, but for over a decade now, the US family planning funding in the budget has remained stable at just over $600 million US dollars. Regardless of whether we're looking at the budgets or the disbursement data, we come to the same conclusion. The US continues to play a huge role in family planning funding. The Donors Delivering Report estimates that the US provided 50% of the total family planning disbursements in 2024. They are critical, and that funding is being cut. Since 2024, the family planning landscape in the US has really altered significantly. The preliminary OECD data that Lisa was showing just before for the US shows that ODA fell by 57% in 2025 based on the preliminary estimates. That decline is not the result of congressional action on global health appropriations. That's remained relatively flat. It reflects deliberate choices by the current administration. The dismantling of USAID, the freeze on foreign assistance disbursements, and then canceling of most of the family planning grants. And then on top of this, there are policies specifically taking aim at SRHR more broadly, including the reinstatement and expansion of the global gag rule and the prohibition on funding to UNFPA. Even when Congress has continued to appropriate funds, including for fiscal year 2026, the full $607.5 million for family planning, those dollars are largely not reaching the intended programs. I included a QR code here to our analysis looking at the impacts of when the family planning funding is being withheld, which it continues to be in most cases. I think the implications for this audience are really straightforward. The 2024 figures that we're presenting today are really the baseline on which steep losses are already being measured and already being felt across countries. And our impact estimates in our calculator really reflect what is at stake with these declines that we're seeing in 2025 through to 2026 data. Thank you for letting me join to present today and for this great partnership between Guttmacher and DSW with our impact estimates, and I'll hand it back to Melissa.
Thank you. Thank you so much to you, Nitya, Lisa, and Elizabeth. I believe I am sharing the same sentiments with everyone that you've clearly and powerfully walked us through this year's findings. We have a few reflections to do after the meeting, since while the data is showing us that there's a slight increase in the global SRHR funding, it's deeply concerning how fragile that increase really is. I was trying to look it from the Kenyan perspective because we're already seeing there is scaling back of services at our youth empowerment centers, outreaches reduced, and some even paused. And young people are now going to public facilities and told to come back next month because sadly we're already experiencing contraceptive stockouts. And I believe this meeting couldn't have come at a better time. Everyone, I'm also encouraging us to check out the impact calculator that will be shared on our chat box and just utilize this amazing tool. So thank you, powerful team, to now help us understand what the findings of our report mean. Would like to welcome the perspective of a donor policy, and we are very pleased to now bring in the voice of one of our SRHR long-standing champions, Dr. Karin Wiesel, Swedish ambassador for global health, representing the government of Sweden. As we heard from our report, Sweden was among the top SRHR donors in 2024, allocating 5.3% of its total official ODA directly to SRHR, an important signal at a time when many other countries are scaling down. So, Ambassador, thank you for joining us today. To start us off, could you share Sweden's outlook going forward on SRH financing and why investing in gender equality and SRHR continues to be such a firm priority for your government? Feel free to add in any concrete examples from your global health network and bring this commitment to life. Thank you. You're welcome.
Thank you very much, colleagues and friends of SRHR. To start, I would like to express our great appreciation for DSW for your important work and for your really yearly report, Donors Delivering on SRHR, and also for inviting me to speak on behalf of the Swedish government to this webinar launching the report. The full and equal enjoyment of sexual and reproductive health and rights for all is non-negotiable. It is a core value and priority for Sweden. Sweden's commitment to health and SRHR has long been a cornerstone of our development cooperation. It is a commitment grounded in human rights and the firm belief that every individual has the right to health, body autonomy, and dignity. Full enjoyment of SRHR is of importance all through the life course, but not the least important for young girls and young women. Adolescence is a formative period and defining moment in life, shaping health, choices, and opportunities for the future. Yet, far too many young people are still denied access to accurate SRHR information and respectful, quality, and person-centered health care. And the consequences are stark: preventable deaths, lifelong health impacts, and lost potential. This is unacceptable, and this is why we must continue to act. The Swedish government is clearly stating that gender equality, global health, and SRHR are prioritized issues. And in times of pushback, it is more important than ever that we remain clear and vocal about our position. Political support is, moreover, as you have seen in the Donors Delivery report, matched by financial support. The share of Swedish ODA for SRHR was 5.3% in 2024, which corresponds to 2.7 billion Swedish krona, or close to $250 million. And the Swedish development assistance in SRHR rests on three mutually reinforcing pillars. 1, policy engagement and advocacy. 2, normative and knowledge-based support, including for research and research capacity. And 3, support to health and rights-based SRHR service on the ground. And together, these three pillars ensure coherence, credibility, and impact. And this approach is not new. Across multiple governments, Sweden has consistently prioritized SRHR, including adolescent SRHR. Our long-standing support to multilateral organizations, to international and local civil society, and to national and global research reflects this commitment. From the perspective of the Swedish government, support to SRHR is also a compelling investment case. But importantly, it is not only about what we invest in, but also how. Approaches needs to be cost-effective, feasible, and preferably aligned with national priorities and universal health coverage commitments. We strongly believe in supporting projects and programs that integrates SRHR into existing systems, into primary healthcare, workforce training, and national budgets, rather than relying on parallel structures. This improves both efficiency and sustainability and supports national ownership over time. At the same time, investments must combine prevention and services. Comprehensive sexuality education delivered in person and easily accessible online tools need to go hand in hand with access to youth-friendly, respectful, and confidential health services. Effective programs, moreover, need to be able to adapt to different needs and contexts. In the end, what truly matters is not only evidence for impact, but clear, practical pathways to implementation that makes reform achievable and sustainable. So to conclude, to invest in SRHR is for the Swedish government not only the right thing to do, but also the smart thing to do. Thank you.
Thank you so much. Thank you very much, Ambassador, for those thoughtful reflections, and especially for highlighting the importance of turning strong policy commitments into predictable, sustained financing. Because I believe we are up to task, or have the task to now advocate for approaches that are cost effective and with community ownership, leading to sustainabilities of the project given to us. I'd now like to turn the perspective of the European Union, which plays a uniquely influential role in global development cooperation. It's a real pleasure to welcome Ms. Cecile Bio, Head of Unit at DG International Partnerships at the European Commission. Thank you for being with us today. The report notes that while UE institutions are major global donors overall, SRHR still accounts for less than 2% of total EU official development assistance. So with important moments ahead, such as the new multi-annual financial framework negotiations and the development of the next gender action plan, I'd like to hear your perspective. What do you think will truly move the needle to prioritize SRHR more strongly within UE external action, especially in this current political and financial climate? Welcome, Ms. Cecile.
Thank you and good afternoon to all. Many thanks first for presenting this report. This is very good to read and to get facts and figures behind SRHR and who are the main contributor, what are the prospects and so on. This is really useful. And I think from our side, and as Karine was saying before, from the EU and our EU member states, we've been committed to the agenda of SRHR for a long time. It is at the core of really our values, gender equality, human rights, at the core of really what we want to do and what we want to support. Of course, we have, as you see in the figures, you have some of our EU member states who are contributing more than others, and it's a fact, like in any kind of topics we have in relation to health. But overall, many of our core member states are really big player also on this agenda, and we're happy to have the figures also to fact that. Now, what will the future hold? Of course, you raised a little bit of the uncertainty coming from some of the donors, where we know that the funding will decrease this year and then the year before. So that would be a challenge, definitely. At the same time, on the EU side, we are not in a position to always increase our funding because we have a lot of constraints also on ODA on our side. So this is a little bit the challenge for all of us, to know how we make the best use of the money that we have available, even if the amounts may not be increasing, at least trying to be as efficient as we can and using other vehicles to help us to really catalyze and make the best use of our funds to really deliver the most. So Indeed, we have the MFF who is coming, the next MFF. So our multi-annual financial framework is ending in 2027. So we'll have a new one, and that's in this context that we will program and then and plan some activities there. It is currently in discussion with EU member states and parliament, so it's too early to say too much. But really, what is at the core, what we have proposed, at least from the Commission side, is still to have a substantial and an increase in the PLR in relation to global challenges, where a lot of the funding on SRHR have been placed so far. And also what is important to keep in mind is that the budget, at least the global Europe part of it, will be very much, well, that's our proposal, is really try to make it more flexible. So having a programmable part and a non-programmable part to really make it more adaptable to the change and to the needs and so on, which could also be something that be at the end beneficial for SRHR, as we've seen if we have in case of crisis where one donor is decreases in funding and then there's more needs. So if we have a tool, in a kind of budgetary tool that helps us to adapt to whatever geopolitical context we have, we believe it would really help us to react and to be more active where we need and where the needs are. So that's another parameter which is very important to take into account for the next MFF. Now I wanted also to raise the Global Health Resilience Initiative, because as I said, the EU is very much committed and continue to remain a stable actor on all global health, SRHR, but global health as part of it. We have issued, it was not last week, but the week before, so 10 days ago, the so-called Global Health Resilience Initiative, which is a communication policy document, but really to reiterate where we stand on global health from a resilience perspective, with the change that are taking place in the geopolitical sphere. What are the priorities for the EU? And then part of this priority, we have, SRHR, gender dimension is very much present across. It's not one priority as such. We have only 5 kind of fields, but very much embedded also in the health system priority. We have priority number 2, which is really to support partner country in strengthening health system, because this is the basis, primary health care, maternal health, and everything that concerns also women health, SRHR, and so on as part of the picture is really much embedded into this priority. And I think that's very much from the next MFF perspective also very important that we see SRHR as being really part of the basic health system and services that needs to be provided to the population. And the last comment I do also in regard to the next MFF and how we may be able to continue, to increase our funding to SRHR, it's also to look at working with other players, because as I said before, ODA is what it is, and it will not by magic increase in the next couple of years. This is unrealistic to think so. So we have to make the best use of what we have and try to find leverage. So clearly, as we are saying a lot under the Global Gateway Strategy, which is the basis of our strategy we work with in the development sphere, is really how we engage with the private sector, how we ensure that what we give in grant is combined with something in loans. We have been working and I'll continue to work with the UNFPA on that to see what mechanism we can put in place, really involving also DFI, banks, development banks, and seeing really how this can be really used to catalyze other funds coming from other sources and delivering more. So basically that's something that is key. And the more project we will have that provide this partnership aspect, working with financial actors, will be much more eager to get supported in the next MFF, because this is very much the spirit also of what and how we want to work in the current context. Thank you.
Thank you very much, Cecile, for those insightful reflections. I appreciate how you highlighted both the political realities the EU is navigating and the opportunities ahead to embed SRHR more firmly within external action, and loudly the power of integration and partnerships. I'll now open the floor for the next 10 minutes for questions from our participants. If you have a question for any of our panelists, please feel free to type it directly into the Q&A box. As we are waiting for the questions to come in, I'd like to use my moderator's privilege to pose one brief question from a civil society and also a youth-led perspective. Ambassador Karin, from the civil society side, especially for youth-led and feminist organizations, what kind of advocacy or partnerships is most helpful for governments like yours when making the case internally for sustained SRHR interventions?
There is not, I would say, one single convincing argument. And as I said in my intervention, the importance of how an intervention is to be put forward, or rather a program that is embedded into the national priorities to show that it is activities or programs that can be sustainable and also that are supported by the government if that is feasible in countries where SRHR is also on the agenda for governments, to show simply that it is a wise investment case and that it respects the human rights and also respects reaching all key populations that are difficult and hard to reach. But as Cecile was alluding to, there are challenging financial times with fiscal space shrinking when it comes to ODA, and not the least for us in Europe and in the north of Europe, having a high priority to support also Ukraine with ODA, but also other means of financial support and advocacy. So it needs to be put forward as a support that really does make a difference, which most support, of course, does. But to check the boxes of efficiency, human rights perspectives, and if possible, catalytic to other investments or projects or programs that are ongoing in the country. And the best is if it can also be sort of anchored into other programs, so it's not a separate pillar.
Thank you for that guidance, Ms. Karin. I can see on our end, we are already having one of the questions, and how are donors planning to defend abortion access in the current context? It's a key SRH service that I feel has to be named and explicitly protected to ensure women's human rights.
So should I continue, or do you want to address that to anyone in particular?
Feel free to chime in, then we will give Ms. Cecile an opportunity to on the scene.
So from the Swedish government, for many years, and regardless of color of the government, the access to legal and safe abortions has been part of the priorities within global health and SRHR. We will continue to advocate for that and the importance of ensuring the right of every woman to decide upon her own body, also when it comes to abortion and the right to decide when to have a child. So that is on top of the agenda for Sweden, and will continue to be so as long as we can foresee right now. Also, we have a lot of support to midwifery education and midwifery to increase the numbers of midwiferys and to have them integrated into the systems, where we see that the best, of course, is to make available family planning tools in order not to have to, for the girl or woman to have to go through an abortion, but also with a midwifery or a skilled birth attendant, but even more so midwiferys, they will follow the girl and woman throughout the life courses and can support both in preventive measures in order not to become pregnant, but then also if that would be the case and it is an unintended pregnancy, to support also in termination in a safe and legal way. Thank you.
Thank you so much for that. We are often hearing about the need to do more with less funding. To find efficiencies and ensure financing is catalytic. Cecile, could you please give us specific or illustrative examples of what this could look like in practice for SRHR and family planning? Thank you.
Yes. So, what is exactly catalytic funding? Well, the most obvious example is, of course, you put a bit of grant and a loan together, basically, and that's what we call the blending thing. That's a typical kind of catalytic equation. From the EU, we come in, basically, usually the loan is being done by bank, DFI. We work a lot, of course, with European Investment Bank because they are the first one, but we also work with DFI from all our EU member states. And they are, because we are not a bank as the EU, and they are providing the loan, right, as a good interest rate. And then we will come in with a bit of grant there to support the project too. So we come with the grant, but we come also, more important, with a guarantee. Meaning often this bank, the EIB or DFI, let's say Copaco or AFD in France, or in Sweden it's SIDA, I think. No, it's well, I don't remember the name now, but okay, you have different banks, and basically they wouldn't go there and do the loan, basically, because it's too risky often. So the level of risk is too high. So we give a bit of grant, but we also give a guarantee to them, meaning they give the loan, but in case at a very good rate, but in case the project fail, we will be the one reimbursing, basically, and covering. So we provide the guarantee. One part of the loss, of course, not the full, but one part, which is the most risky. So that's a little bit the kind of model we are using more and more. How can it be applied to SRHRs? For different things we are looking at. And here we need to all work together and be creative and need to find ways. But for example, if we want to produce SRHR commodity on the continent in Africa, we can apply this model by giving loans to private sector operator, a bit of grants that can be vehicled to private sector or to research institute or to skills institute to work on training of the people, training of the health workers that will receive the commodity, whatever. That comes a little bit from activity which are not purely private, but it's for the global good. That's what we do. And then with a guarantee. So that would be one option, finding some investment who wants to produce a commodity good on SRHR on the continent, with having together either local manufacturer or EU big company or smaller company that want to invest in Africa and manufacture the goods. That's one possibility, but it could also be doing this model, which I explained before, towards any government in Africa who wants to either buy SRHR community or invest into making a center, planning family center. Again, as I said before, very much linked to also the health system, maybe building a sort of community center, whatever, with a SRHR or family planning dedicated section, and it's some funds, so we could take a loan to do that. We will give a bit of grant, and then the government will reimburse the loan as it goes and according to its possibility to the bank that is concerned. So that's another example, which is very much infrastructure. But it could be also with services, or if you have a dedicated services and then we want to do also a transaction like this, it could be a service provider coming from the private sector or semi-private, whatever, who needs really to invest and that doesn't have the capital and cannot find the capital anywhere on the market, then they could have access to this capital, which is de-risked and de-risked by us as the EU. And these are only ideas, and this can be also go much further if we work together on knowing who are the key actors, what are their needs. And of course, that the actors need to move from a mentality of having 100% grant, but also having to to have to reimburse, to invest in the project, to work on the basis of loan. It's not always easy for all the actors, and it's a different model. But this is very much the reality, is that the 100% grant type of model is a bit of at risk. I'm not saying we won't have any more, of course, with civil society and so on, we work with grants, but it's more limited. So you need to make sure you adapt also from a model that is not only from grants, but is building grants and loans, or it can be venture debt, it can be volume guarantee also for commodity, any type of financial tools that is needing to really get capital, really needed for the investment on SRHR at the country level.
Thank you so much. Receive your flowers to Miss Cecile, and to also our ambassador. Receive your flowers. Thank you for the rich reflections, and to our participants, thank you for those thoughtful questions. Unfortunately, that is all the time we had for our Q&A today. And I know there are still many excellent questions that are going to come to you after the webinar. Please don't hesitate to reach out directly to Lisa and Nitia George at DSW. There's also a QR code that was shared or is going to be shared immediately on our screen for you to get access to the donors report, where you can dive deeper into those findings we have discussed today. I will now hand over the floor back to Lisa for our closing remarks. Lisa, take it away.
Thank you very much, Melissa, and thank you again to Cecile and Karen and Beth for joining us here today, and also for the tech support behind the scenes, which has been, as always, a pleasure to work with. And to everybody who joined us here today, it's just the beginning for us in terms of dissemination. We really hope to carry the results and the findings into the world out there. And I know that it feels from today's perspective like, why are we talking about 2024 and we need to focus on the now? But I do think there's value in tracking development over time. And we had a little bit of a brainstorming what other stories and data we could put together. We think one of the big benefits of this data is, of course, it depends a bit. Nothing is 100%. How are donors reporting to different CRS codes, the timing and the natural fluctuations from year to year. But I think what we can really build on and rely on is the percentage data. So if we're looking at how donors are prioritizing SRHR within their ODA, we might be able to look at how this developed over time. So stay tuned. Maybe some more insights coming your way soon. And I hope this will be helpful and useful for the SRHR advocacy community. And yeah, thank you, everybody, and be in touch. Bye-bye.
Bye-bye. Thank you so much for joining us, and see you next year.
From Kenya, we say kwaheri till next time.
Thank you, everyone.
Thank you. Bye-bye, and well done.